Today we are going to talk on something global scenario of the world, which is an epidemic like diabetes. Focusing on diabetes is very important as a reason because it's a global epidemic taking a whole world as a toss at long-term complications of diabetes. The ratio is increasing year-wise. It includes from a small kids to age population. We look into two parts. One is type 1 diabetes and second is type 2 diabetes. If you see combined population age which varies from age 1 to aging population of 50 plus and 60 plus and 70 plus. So in brief, if you see in all, there is no exemption of age limit for diabetes. Maybe pathophysiology for both the diabetes is different, type 1 and type 2. And there is one third entity which comes in called as a latent autoimmune diabetes, that is a LADA type of diabetes, which the phenotype looks like a type 2, but it's again in type 1 diabetes. In fact, the entire ratio of population globally, if you see, earlier it was 5% of the global population, now it has grown to 7 to 8% of the global population. The leaders being US, China, Mauritius, Middle East countries, and India is among the ranking countries where again 8% of population shows the diabetic. Whereas in type 1 diabetes, around 1 lakh every year are being added to the population. It's very pathetic when we see small children taking 3 times a day insulin and 3 times checking their blood sugar, multiple injections. I mean, a lot of control in the food, and in spite of that, nothing happens to them. Their glycemic index remains very high. So we focus on first time the type 2 diabetes, and then we go to LADA, then we go to type 1 diabetes, that is juvenile diabetes. Mostly type 2 diabetes is we call adult onset. We call them to be a familial, we call them to be a lifestyle related disease, we call them to a sometimes genetic relation, whatever it call, but it generally represents after 30-40 years of age. There is lean diabetes and obese diabetes also, their behavior is different in both type of diabetes. What we have to see that apart from the word diabetes which we call, is it a disease or it is caused by the lifestyle is we need to understand. I don't feel that this is a disease. It's a lifestyle modification, I'll tell you. It is a gift of your lifestyle, related with little familial representation. In such cases, when I look at the conventional method to treat this kind of disease, we almost fail in all type of diabetes treatment. I have never ever seen a patient who has taken a treatment from oral anti-diabetic and he has gone off the diabetic treatment and he has remained without any requirement of oral diabetic and controlled his sugar with normal glycemic index, that is 5.5 to 6 or 7. They have been always changing from oral one diabetic to other, third, fourth. Then they may go to an insulin dependent again. And once you go on insulin, to get out independent from insulin becomes one of the most difficult job. On the contrary, we keep on adding one complication to other complication. And from one who is non-symptomatic becomes a symptomatic. What is symptomatic means? Symptomatic is the complications of diabetes, symptomatic representation. And once you symptomatically represent with neuropathies, angiopathies, nephropathies, retinopathies, life becomes very much morbid with lot of limitations. And remember, when you take focusing on one organ of diabetes treatment, never ever forget the other organs are following in the queue to fall with the sufferings. So treatment, if you talk of diabetes, is not a conventional method. I don't recommend those things. Most important for, in my opinion, diabetes treatment comes only by regenerating potential of our body, not by taking oral medications. I call this theory to be called a regulation and deregulation. Regulation means the cell-to-cell communication and then passing on information what function has to be done. Now deregulation means cell-to-cell function doesn't take place because the information from one cell to other cell doesn't go, and the function of the organ doesn't take place. Now, this deregulation regulation plays a major role in type 2 diabetes, particularly in the pancreas and peripheral systems, where a lot of inflammatory environment has developed over a period of time because of the lifestyle, food habits, stress, the way we live life. Now, this environment which has gone wrong in the body, which I call to be inflammatory environment, even if we see inflammatory molecules, inflammatory cytokines like TNF alpha has increased in high level. The other TNF molecules parameters are also increased. This shows that the environment is not good, and the breakdown of the insulin to glucose doesn't take place. The ratio of insulin creating glucose to enter in the cell for complete utility doesn't take place. Now, this is also affected with the hormones. Like as you grow older, your male hormone levels go down, like testosterone level come down. The sensitivity of the insulin also affects on that. All this is a multi-organ involvement. I call type 2 diabetes a multi-organ involvement, like hormones are concerned, inflammation is concerned, pancreas is concerned, peripheral organs are concerned, when there is an inflammatory environment in the body. All that has to be reversed. Without reversing this, if you think of I'll take oral medicines or insulin, it will ever no show the result to you, but it will add in one or two other complications and lead you a failure of the organs. Now, in my plan of treatments for diabetes, I always insist, instead of failing organs in the body, can I, for a fraction of a second think, can I regenerate those organs? Yes, I would say rather yes, we can regenerate the organs. Like in pancreas, the tired beta cells, by producing insulin, can we give them the new strength, new life, new creating pancreatic cells? Yes, we can do that. Instead of going for insulin from outside or oral hypertension, can we reduce the inflammation in the body? Yes, we can do that. By keeping the food habits remain the same, except the atoms changing, an exercise, yoga pattern, and putting them in the stem cell therapy. And the stem cell therapy, particularly using autologous stem cells from their own body, will help to reduce the inflammation, at the same time help to regenerate the beta cells in the body. And so as we should not get into same trap of cycle again of diabetes, we have to put them in a lifestyle modification which plays a major role, particularly yoga treatments, a diet which we create to maintain an alkaline environment of the body, so the acid environment goes out, the diet which keeps your intestine healthy to allow proper healthy foods to absorb, keep a low glycemic index. It's not that we should not eat sweet. Yes, you can eat sweet, but the sweet has to be replaced from a glucose to fructose type of foods. Fruits. You can enjoy fruits. You can enjoy seeds. You can enjoy dry vegetables. You can enjoy all those things what you want, except the milk products I avoid, my food products in my food list, as well as cereals I avoid it like. And then you see the way glycemic index reverses back to normal. Stem cells will help to produce the new beta cells, reduce the inflammation, and the life will be free of diabetes. This is particularly for the type 2 diabetes. The second part remains a third type I told you, LADA type of diabetes, that is autoimmune diabetes in adult onset. In these cases, though phenotype remains like a type 1, type 2 diabetes, but again antibodies, particularly islet cell antibodies, play a major role. So we have to focus on antibodies, particularly on Treg cells here, autoimmune body, immune system. Here we play a major role of educating the T cells, Reg cells in type 1 diabetes, where the principally immune system has failed to regulate so as they should not produce antibodies. Now here there are two types of cells which play a major role, is the T cells and B cells. Now T cells, we have effector cells and regulatory cells. If we functionally improve T regulatory cells to express high level of or upregulate their FOXP3 and CD25, things will change. The T regulatory cells will take up and suppress effector cells and beta cells so as they will not produce antibodies. And these antibodies which are responsible to destroy the beta cells will stop. And the innate potential of the body of regenerating beta cells along with the stem cells what we use, it can help the children's type 1 diabetes children's to get out of the diabetes. And the pathetic solution what we see, they take 6 times a day, pricks in the body can be stopped. And the children's which go in a kind of diabetic complications early age, maybe 20s, into retinopathies, nephropathies, neuropathies, they will not go. They'll enjoy a full-fledged happiness of life. We have wonderful results in type 2 diabetes as well as type 1 diabetes, either LADA diabetes. This is a program which works for at least 6 to 8 months program, and you have to live a world without diabetes. This is one of the innovations by stem cell technologies or regenerative medicines, where I'll assure you a quality life without diabetes. If you have anything to ask me, you can communicate to me through on my email addresses drpvmajan@fstemarix.in. Thank you.